need to respond to threats that are at this point unknown?
Okay, well, those are good questions. One of them is to regulatory flexibility. And I have to say, I really want to tip my hat to the FDA, because over the last several years, without cutting any corners, they have worked with us right from the very beginning, in the sense of usually you start on a project, you go towards a product early, then you get a product, you need to bring the FDA in for a final approval. Right now, whenever we do anything, we get them involved right from the very beginning to make sure we're right on the right track. You know, they don't design the pathway for us because they can't do that, but we always go with them very, very early on. I think that's one of the things we need to do.
Great. We learned a lot of lessons from HIV and AIDS. We also made a lot of investments in infrastructure that are still there. You mentioned the persistent burden of infectious disease, but the majority of deaths globally from non-communicable diseases. In a resource-constrained environment, how do we look at the infrastructure we've built, the infrastructure we're building around other diseases, to leverage that to expedite our response to emerging infectious diseases?
Okay, I think the classic example among a few that really is a success story is PEPFAR. So, for example, the countries that have benefited and the organizations that have benefited globally from PEPFAR, when other challenges came along, the PEPFAR countries inevitably did better than the non-PEPFAR countries because they already had that infrastructure in place. So PEPFAR is a good example. Then there are individual capacity building events that have occurred. So when we went into West Africa, we concentrated on Liberia because of the traditional USA involvement in Liberia. And we made it a point that when we started the vaccine and the treatment and the survivor trials, that we said we would do that in the context of building a sustainable infrastructure. So we have rules now that we don't go into a country unless we're going to leave something there that they could continue. It isn't in and out. That was not the mindset years ago.
So I know you're on the infectious disease side, but are there lessons we can learn from investments around non-communicable diseases
Oh,
as
yeah.
well?
I mean, obviously, when you look at some of the clinics that got set up with PEPFAR, maternal child health is benefiting greatly from that. Cancer screening with HPV and others is benefiting greatly by that. And that all is emanating from PEPFAR.
I know you have limited time. I don't know if we can convince you to take a couple of questions.
I'll be happy to.
We'll follow the same rules as earlier, a quick introduction and a quick question, and we have time for a few more before our closing. But I see a hand right here.
Hi, I'm Kavita Berger from Griffin Scientific. I have a question that you refer to very nicely in your presentation, and also Ron Klain had referred to in his presentation, which is really leveraging the scientific information to be able to understand what's going on and then respond in an appropriate way. And as you obviously know, yesterday the federal guidance came out on how agencies and departments should implement dual-use research of concern with pandemic potential. This is an ongoing thing for 5 years or more. How do you balance those types of policy and regulatory sort of issues with wanting to have and build a robust scientific capability to address some of these real problems?
Well, I mean, obviously, and the answer is going to sound somewhat simplistic, but it is that you always guide by the science as long as you stay within the general rules and regulations that are made by society. I don't see the P3CO is what they're calling it, right? Pandemic potential pathogens of something concern and oversight and something or other. We've been dealing, as you know, we've been dealing with that for years. It has not interfered with our ability to do the kinds of research that we want to do on pathogens of concern. It just hasn't. And if you look at the big picture of what's been done, the good news about that is that it sets up now a evidence-based scientific system to evaluate experiments as you're thinking of planning them. So rather than saying, do it and then see if it worked out or not, it says, this is what you want to do. These are the guidelines. If you go by the guidelines, then we know what you're doing. I haven't seen this interfere in any way with anything that I think is scientifically important.
Looking out. Okay, then I'm going to ask one last question. Yeah, unless I'm just blinded by the light, which is a possibility. Let me just ask one last question. There was a lot of reference to the earlier today about the linkage between the security communities and health communities. And again, you've had experience through this. I'm thinking of this both as sort of a political messaging where reference was made earlier on. I think you were in the room to how effective a messenger you've been on these issues. So there's both a public messaging role as well as an infrastructure and response role. I just wondered, you talked a lot about the science side. If you could give us some of your thoughts on how to improve that linkage in terms of response.
Between the science and the security?
The security and the health communities.
Yeah. Well, that really worked extraordinarily well, both with Ebola, and we got even better with Zika. Because when we have our discussions as a whole of government response, we did it in a way, we've really got it down well, that in the room, the National Security Council, Lisa Monaco, when we really get up to a big decision, we have Lisa there, we have Amy there, we have the people from the security there, and we have all the health people there. We have the CDC, the FDA, myself, and the secretary, and it really works well. In fact, I wouldn't say surprised, but I was gratified by seeing how when you get really smart security people who always, to their credit, when it comes to a scientific issue, listen to the scientist. But when it comes to the potential impact in a security way, they have an incredible amount of experience, and it's worked very well. It's been one of those things where you come out of the meeting saying, "Why, that was really worthwhile."
Well, given your commitments, before I turn it over to Ashish to say some closing remarks for the day, I just want to say not only was it a very interesting, informative presentation, but like some of the other comments we heard this morning, it's important, I think, for people in this room to thank you for your service in our safety and security, in addition to appreciating the presentation you gave. So thank you very much.
Thank you.
Sorry, guys. I'm going to try to hold this so it doesn't fall off. We're finishing up, and there's still some food in the back for those who didn't get a chance to get it. I want to wrap up by just making a couple of remarks, and John had to run off actually to Chicago to listen to the president's farewell speech that he's going to be giving, and so I promised him that I would close up for us. I think we've learned a lot this morning, and as we've headed into the afternoon, and it has, I think, been a remarkable morning of people who have been deeply engaged on these issues, who've really been the national leaders. Certainly in the two panels, people who've been deeply engaged in the last 10, 15 years, and then there really is nobody that the country owes greater gratitude for his extraordinary work on infectious disease, on health security than Tony Fauci. And so to listen to him give that history, I think was pretty extraordinary and a privilege. I'm going to make a couple of remarks of things that I learned, some things we knew coming in, but some things that I think are worth noting. Pandemic prevention and preparedness is going to end up being, whether the administration likes it or not, a priority, a top priority. One of the things I think we heard was there is only one thing we can predict with confidence. There is going to be something unpredictable that the administration is going to have to deal with. And so this is not something where, boy, maybe it'll come up, they may have to deal with it. The second is we artificially, and we knew we were doing this artificially, set up a domestic panel and a global panel. And we knew it was artificial, and you heard it from the first moment that Amy Pope started speaking, that there really is no distinction. That to protect the American people, we have to deeply engage with the global community. Right? There are no walls, there are no barriers. We are in a hyper-connected world, hyper-dependent, interdependent world. That is no longer, if it ever was, a feasible strategy. The third is because we cannot predict, we have to rely on some tools we have developed. And one of the things that we saw in Dr. Fauci's talk consistently was that slide of the countermeasures. That no matter what the world throws at us, we have a set of countermeasures. And they are science and they are basic public health. And we cannot get away from those. We have nothing better. And that's what we have to stick with. A couple of other comments. One of the slides that Dr. Fauci had, which I thought was very important, something we learned from Ebola, something we got better with Zika, was that fear spreads faster than diseases. And that is something that we in the public health community, in the global health community, have to get much, much better at acknowledging, understanding, and dealing with. These are scientific issues, but they are also issues of communication, of engagement. A couple of last points. I think you heard a consensus among people with a wide range of political views that we really cannot do this without a public health emergency fund. As much as that is a political tough sell, that is something we are going to need. Second is we're not going to be able to do this without deep engagement with the private sector. And last but not least, one of the things that I took away was this idea that when we make the kinds of investments that we do in public health and in global health, they have effects and payoffs that go far beyond the intended consequences. Right? We did PEPFAR to deal with HIV and AIDS, but it has paid off. It paid off in Nigeria, when Ebola went to Nigeria. It pays off in things like improving maternal and child health. And so we have to begin to connect the dots in global health and pandemic preparedness and say these things are far more interlinked than we think they are. All right, all of you probably had other lessons, but those are some comments that I wanted to quickly highlight because those are things that I think were some of the highlights of the day. Let me finish off by once again thanking Rebecca Katz, who was really our intellectual leader of the day, Andy and other members of her team who pulled this whole thing off. It looks easy, it's incredibly hard. And so I'm incredibly grateful to Rebecca, members of our team, Liana Waski, Sarah Brandstrader, Margaret Saunders from Health Affairs. This really was a truly collaborative effort. First of many to come, so you're going to be hearing more from us. Thank you all for participating, engaging, and have a good rest of the day, and thank you all for coming.